All right, so today we've got Daniel joining us. Daniel spent a few months with us at Pelvis NYC, getting an inside look at how we approach pelvic health and pelvic floor therapy. During that time, he got to see the way we evaluate and treat a lot of complex cases, things like pelvic pain, urinary issues, sexual dysfunction. Daniel will speak more about kind of what he went through. But after his time with us, Daniel wrote us a really raving review, and we thought it was a great experience. Because he had went through a great experience, if we can bring him on the podcast to talk about, what he saw, what he went through, what brought him to pelvic floor therapy, and of course your perspective, Daniel, on what's going on now and prior to coming to therapy. So let's start there, man. What brought you to pelvic floor therapy? First off, actually, let's introduce yourself. Who's Daniel? What's going on?
Yeah,
Yeah.
thanks, Adam. I appreciate you having me on. My name's Daniel. I am 39. I just moved to New York City about a year ago. I've been in Los Angeles the last 15 years, working in entertainment, and living my life. I'm originally from the San Francisco Bay Area, worked in TV and film. I'm now in the nonprofit sector. So found myself in New York and I'm really loving it. And I'm like, what else can I tell you outside of my career? I feel like that's the boring part.
Your social security.
I'm a Scorpio. I don't know. Yeah, I guess how I found my way to you, it's interesting because I have a history I can kind of get into about like all of the things I've experienced, but the
Whatever
reason,
you're comfortable sharing.
yeah, like how I originally found you was I was reading a Business Insider article that you were featured in, and the practice was featured in, and I originally read it for the purpose of my dad because the headline talked about frequent urination at night, and my dad has prostate cancer. He's not seeking treatment for it, or I'll say he's not seeking Western medicine treatment for it, which is another subject. But I talked to him a lot about it. He has frequent urination. So I was kind of keeping him in mind reading the article. And then as I got further into it, I was reading the symptoms that you were discussing. And I was like, wow, a lot of this sounds really similar to me. And so I booked a consultation because at 18, I went through sexual assault. Little did I know I had a fissure, a hemorrhoid. I was using substances. I was drinking a lot through my sexual encounters. I didn't want to feel any of the pain. I didn't really understand bottoming, penetrative sex. It wasn't, I just thought there was something wrong with me and I was just not getting it. So I was trying to numb all of those things. Eventually, I had surgery, and I can get into all of that later, but just giving you the Cliff Notes version. Eventually, I've dealt with the discomfort for so long, had surgery, still was feeling pain, and bottoming was so stressful for me. And I've sort of tried all different methods in which I was even considering at one point doing like anal Botox because I was like, I'm not relaxing. I'm not understanding it. And then I read that article and then I booked the consultation with you and it's really changed my life. So um, um, that Google review I feel like is a very like Cliff Notes version of like how in depth my gratitude is for you and the practice and holistically how you treat patients because it has been so impactful in my life.
Thank you so much.
Yeah.
you know, Having patients like yourself who kind of go through the gamut of these experiences and then kind of come out on the other side. I mean, it's truly a blessing to be a part of that. So I'm just as grateful. I kind of want to ask you about the surgery when you had the consult with the surgeon, and then kind of like post-op. Were the expectations met? Did the surgeon kind of let you know that there may still be issues down there? Do you feel like the surgeon could have done more? I mean, talk to me about that.
Yeah, I didn't have the best experience with my surgeon, and I will say this, I went to a very well-known practice in Los Angeles, and the post-op care was pretty bad, and there were things happening to my body that weren't supposed to be happening post-op, like I didn't have a bowel movement. So I had uh, sphincterotomy. That was the first procedure I had um, for the not the fistula. I'm sorry, for the fissure. So they corrected that, and they corrected the hemorrhoid. And in the process, I didn't have a bowel movement for like 7 or 8 days, and then that caused a fistula, and it was a really traumatic experience, the whole post-op care. When I would go through for follow-up, they saw the fistula, and they didn't think that's what it was. They wouldn't do any sort of follow-up testing, and so they would cauterize that wound, thinking that it was drainage from something else, and there's so many like gory details, and that alone was a traumatic experience because I developed a hematoma that burst and caused the fistula, and they had to drain the rest of the excess fluid, and the cauterization process was so painful, and I like I literally like wet myself as it was happening when I was coming in for follow-up care. And that caused, I mean, as you know, with fistulas, it's like if you're not treating it or correcting it, it's that fluid has to go somewhere, that fecal matter has to go somewhere. That caused another hematoma on the other side of my asshole. And when that was developing, then my doctor ordered scans, and I went in for a follow-up surgery, and he corrected then I had a fistulotomy. And so the whole process, and again, that's sort of a tangent of like what ended up happening, but the whole process was traumatizing, and something you and I talked about was the emotional response to all of this, because I'm going in for a procedure that has been caused and exacerbated from trauma, and then the recovery is trauma too. So everything about people being in my anus is terrible, and like my body just was like wanting to reject every step of the process. So the whole, thankfully with the second surgery, it got better, but a year later for follow up, if there's any discomfort or pain, or if I had like any sort of bleeding, I went to several proctologists to follow up, and they all said the same thing. And I think, which being, they basically said, you're probably not going to have penetrative sex again or be able to, because of the scarring, and that could cause another tear. And so anytime I would go to have a sexual encounter, there was just this fear constantly inside of me, thinking like I'm broken, I can't function this way anymore. And it was really psychologically damaging. And then to be able to try to communicate that with partners. So the whole follow up from the procedures were pretty awful.
What was that like? What was the space between the post op and I guess the like when you went back in to tell the doc like I still feel pain? What was that year like? I mean, were you kind of navigating it alone? Were they helping you out in any way? Did you seek out other methodologies to care or?
Yeah, I mean, I think it's a good question. So I'd say it was my immediate circle of friends knew about it, and then I would tell people, because between the first surgery and the second surgery, and not knowing I had the fistula, I was basically in a diaper for 6 months, and I'm a pretty open person, so if like I'm carrying my like donut pillow with me wherever I go, and people are like, "What's that?" I'm like, "Oh, it's a donut pillow. I'm in a diaper. I had surgery." And then it just, has like it elicits these conversations. And so the more I started talking about it with people, other friends of mine who are in the queer community, some not, but were like, "Oh, I've been dealing with the same thing." So it kind of opened up this interesting dialogue with people of, "Oh, sometimes I'm tight, or sometimes I deal with pain, or I experience bleeding. Like, what's that about?" And I think during that process, that like follow-up year, I was noticing I felt really isolated in the process, but I wasn't alone. I think there's so many other people who are experiencing the same symptoms that don't know what to do, and they don't know how to treat it. Or so we just go to social media, or, you know, w- there's so many different ways we try to like course correct on our own, and then it becomes like I'm thinking, maybe I'll just do the, anal Botox. That's gonna allow me to open up, or maybe poppers, like all these things, which I'm not saying they're bad. It's just I think there's an underlying issue there that I didn't realize could be corrected in a different way. So, and that was back in 2018, 2019. Seeing you in 2025, granted the pandemic, it's like so much time went on between the trying to fix something, trying to course correct, and then actually coming and finding a solution, which, just a long time to be in pain and feel like, oh, I'm crazy. I'm the only person this is happening to.
Yeah, and that's one of the big things we see here, right? No matter what people go through, everyone thinks they're kind of alone. And to be fair, you went to the experts. You went to see the proctologist, the surgeons, and by definition, the surgeon did surgery. He or she completed their job, right? Can they do better on the bedside manner and the post-op stuff? Sure, but like by definition, they have done their job. But post-op, you're like, well, what do I do now? And then the worst part about this is you don't have a medical background. Now you have to be your own advocate.
Right.
And that's really difficult when you're like, I don't know anything medical. And someone's telling me maybe to do some Botox. You Google some stuff. Botox is a neurotoxin. You hear side effects from it. You might read like, I need my sphincter. How can I Botox my sphincter? Like things go through your head and you can't come up with a viable answer. And you're like, fuck it, I'll just do it. Yeah. And a lot of people get to this kind of corner and where they feel alone and there's not many people talking about it, which is why it's really important to get on podcasts like these because you're bringing it to light. And hopefully someone doesn't have to wait 7 or 6 years to see a pelvic floor therapist because, well, the other question I was going to ask you is I'm sure pelvic floor therapy wasn't in the post-op care or something you found out about.
Mm-mm. No, no, it literally hasn't been until reading that article. I mean, and I've talked to even some of my friends who identify as female, that pelvic floor therapy, PT, is more in the zeitgeist for people who have had babies and delivery. So they're aware of it, but even my friends who are aware of it haven't been, or they have issues. And so it's just really interesting because it's that post-op care that never came up as an option of something that I could do or seek out. So I kind of just, I mean, I went to a sex coach even because I was like, maybe it's something, it's like maybe it was something psychologically, but as you have mentioned to me several times, it's like it is the physical and it's the psychological and emotional, and it's all like looking at it holistically versus just looking at it from, oh, it's painful or it's tight, you have to relax. So I'd hear that all the time, and that's so stressful to hear. Like it's almost feels like it's shame based of like
It's
you
like it's
just
your fault.
yeah, you just need to relax. And I'm like, if I could do that, I would do that. I want to do that too, you know?
Yeah, yeah, yeah. And one of the worst things that our patients hear, and I don't know if you've heard this, they're like, you get some sort of provider that's like, oh, so you have parasympathetic and then you have sympathetic. And right now you're in sympathetic dominance, right? Like you're in fight or flight. And you're like, great, I know I'm in fight or flight. How do I get it down to not fight or flight? And you're like trying to make sense of this. And the truth is, we all live in New York. Kind of all of us are at a baseline fight or flight. We can call it that. But what happened with you, essentially, you had trauma in an area and your body learned this response of essentially tightening up and tissue that's scared, let's call it, right? And that's a subconscious response. And so you had physicians that told you, hey, you're never going to bottom again. You might not even have a normal bowel movement, which I don't know how anyone can say that. So I wouldn't say it was trial and error with you because we've treated, and I told you this at the beginning, we've treated this many times before. And I even gave you that crazy scenario of that patient that had, he had 3 or 4 anal surgeries. Do you remember that?
Yeah.
Do you remember that? 3 or 4 anal surgeries, and he was a bottom. He didn't want to stop bottoming, and I told him, I was like, look, I don't want to like impede on your lifestyle here, but like just take a break, right? So that things can heal. And he didn't want to. And I told you, it did take us 8 or 9 months, but if he would have not done that, it would have been much sooner that we would have gotten better. But we still gotten better, and that's my point. And that's how I knew you were going to get better throughout this course of treatment.
Which I didn't believe you the first time. Or like the first 3 times I was like, I hear you, I've dealt with this for so long. I just like you kind of get to the end of your rope and it becomes this thing of like I guess, but I think it took like at least 3 months for me to like actually start seeing the results, and like my body was just naturally able to open up. And like even the example you gave me of like, you held my wrist to give me the example of like how tight I was versus how tight I am now. And like it was this really cool understanding of like, oh, my body is able to do this. It was really empowering, you know?
Yeah. Yeah, and you're able to do it, right? But we're just getting Daniel to tap in to what his body can already do, you know? And like, look, do we get all of our patients better? I mean, if I think about it, we're probably like above 94, 95% of our patients getting better. Some don't, right? But you were a really good example of what happens when both the patient and the doctor like are able to connect, where both of them kind of understand what needs to get done, so to speak, right? After 3 months, your body understood, like, oh, okay, I can let this go. I know how to let this go. This feels familiar now.
Hmm.
Once you tap into that, you don't lose that progress. You haven't. I mean, we haven't seen you since December, and it's
Right.
March. Have
Right.
you regressed in any way?
No, and I literally thought I would after like a month, and I was like, "Oh, wow, okay." But like again, we've talked about this even between sessions of like, if I go a week or two without seeing you, am I going to regress? And you were like, "No." And it just hearing that, it's like allowed me, I think, to also believe that. And then it's getting that muscle memory and that and like psychologically believing that too. So like, but I appreciate you saying that too, because it's like that's also a constant battle I have to have internally, because so much of it is psychological of like, I'm crazy, my body's broken, it doesn't know what it's doing. These experts are telling me like I'm never going to have these things again. So that just runs rent free in my head sometimes. And this is sort of combating all of that narrative, which has been great also to receive that and put that into practice and be like, when it's happening in my head, I have to go, oh no, that's an old narrative. That's actually not happening here. I can relax. I haven't lost this progress. So it's been very cool.
And your progress has nothing to do with what happened in the past, whatever it may be. I tell this to all my patients, whether it's physical trauma that occurred, meaning like if you could picture someone grinding a rail like on a skateboard and they fall on the rail, that's physical trauma, correct?
Right.
Or there was a pathogen in the area. I think I gave you the spiel, right? Someone has a bacteria or whatever, and like your pelvic floor learns how to contract but not let go. Whatever it is, we're just getting you to undo that. And that's what the whole biofeedback process is. That's what's getting you to breathe while you're there, not focus on your pelvic floor. Daniel has put so much attention into his asshole, right?
Yeah.
That at some point it's like you have to take the attention away in order for you to feel comfortable again,
Yeah. Absolutely.
right? So good. I'm glad. I'm glad this worked out for you. One question I like to ask is like, how do you feel like Pelvis NYC's approach differed from the healthcare providers you've seen? This is not to toot our own horn, but really just to kind of like tell people, what goes on here and yeah, and how we care.
I think from what I was saying earlier about the holistic approach is the key, because it's not just looking at the okay, you're getting the problem, but like sometimes people can say the problem requires this solution. But when you and I were talking and really understanding like where I was psychologically going into these situations, what I think about it every time I have a bowel movement, like all these narratives. It was almost like Pelvis NYC was able to really normalize what I was navigating and treat the physical part of it while also, like, you guys aren't therapists by practice, but it's almost has an essence of therapy, because you're able to talk through the underlying issue too that's going on psychologically with me, so I could feel safe. So subconsciously that could also affect my body in a way. So I felt like the more we spent time together and we're in sessions together, um, it just holistically felt like things were kind of coming into place. Like I felt like I was able to get to know my body better in this process and like give myself more grace versus just doing an exercise. Or like sometimes like with with PT, it's so easy to see a specialist and then they go, okay, you're gonna do this many reps on this machine, but not actually understand like why you're doing it, how you're engaging, and then the next step of like why you've done the things you have in the past. And that's okay, but this is why we're trying to spend time with it. So I guess to say more succinctly, I think Pelvis NYC really focuses on a more holistic approach, and that really works for me. I want the details. I want to understand on all the levels of the way my body works, and I'm still figuring out how my body works at 39. So um, that really worked for me.
Yeah, to be fair, we see this a lot in even regular orthopedic physical therapies. They kind of just throw exercises at patients, and they're like, "Just do this." But um, that's there's nothing skilled about that, right? And so, like for us, um, everything we do here in regards to like sexual function, bladder, bowels, these are like fundamentals of like human life. And if any of those get kind of like, if you have if if any of those get if there's an issue with any of those, like your life is going to be like really affected, yeah. And so I think especially those like proctologists, we've met many, even gastroenterologists who are incredibly dismissive. They're not taking in the emotional aspect of what's going on with the patient, yeah. And so if a patient um, isn't able to go to the bathroom, like by definition, he's anal retentive, and so that does something to the psyche as well, you know. Um, so there's a lot to take into account, and I feel like we do that well. Don't forget, I was a patient, and so
Exactly.
everyone saw me as kind of like a cash cow at some point, um, and that was not a good feeling. And so we're very much patient first here. And that's why we tell you when you're like, hey, I can't come in for a few weeks. Is that okay? From a business standpoint, that doesn't help, but that's not how we work here. We want to make sure that we're not adding more fear to
Right.
fear.
Exactly. And I also would say on top of this, I think this goes without saying, but I want to just be vocal about it on your podcast because it's true. The proctologists I'd seen in the past weren't necessarily queer friendly or aware, like they weren't doing any sort of gender affirming care. Like there was no like it was almost like the proctologists I'd seen were not even taking into account that like I was a queer person. I was not just having bowel movements, I'm also having sex. It was like that wasn't even considered. So there was this level of like not understanding and not creating that safe space. So again, just like more fear. Um, oh, I don't know why I'm ringing.
All right. Did you bring up the sex part to any of these physicians?
Yeah, I mean, I brought it up several times because it's like as I shared my story with you, that's what I would share with the doctors because I want them to know like and have all the details because if there's something I'm missing, I want them to have as much ammunition or as much detail as possible to help me understand like what I'm not seeing or what could work for me. And it just it's almost like a lot of the doctors were very dismissive, and I never felt like that. In fact, it's the opposite when I come to like Pelvis NYC. I feel like you have queer people on your staff, like you don't identify as queer, but you're one of my favorite people. Like I love talking with you. I think it's so like and you also understand like having been a patient yourself, like you're not just telling me like this is what you need to do. Like you've gone through the process for different reasons, but it's still all interconnected. So that just creates a safer space, which I really appreciate.
So it's funny because I was gonna ask what's it like as a gay man being treated by a straight man? Because on the flip side, a lot of patients always ask me, they're like, "Oh, do you get guys in here that like when you do an internal or we work on their pelvic floor, they're like really freaked out by it?" And like occasionally I get guys, um, and maybe you call it the bridge and tunnel crowd. They're the straight guys who are like,
Yeah.
"By the way, I'm not gay," and I'm like, "Yeah, neither am I. I'm just like this is a medical thing. I'm treating you right now, you know? So, yeah, you kind of answered it, but if you want to expand on that, you can.
I get a lot of like my gay friends will be like, "Do you get hard with him?" And I was like, "No, it's not sexual. Like it's so funny." And they're like, "But he's a straight guy." And I'm like, "Honestly, I don't know for me because so much of my trauma has been from the sexual assault. And when I'm trying to have sex with other gay men, there is a built-in narrative, like the stakes feel higher. The stakes don't feel high with you. I'm not trying to have sex with you. Like, I feel
Appreciate
like
it.
you're, it's like you're a great-looking guy, but like,
Thank you.
it's almost like we talk about this, like there's no pressure. So it's almost like we're in an environment where you can work on me and I'm not thinking like I have to perform or I have to do X, Y, and Z. Like my body can actually just relax. So for me, and I can't say that's going to be everyone's approach, but like for me, it's great because it doesn't feel like there's any pressure with you. Because like sexually, that's where a lot of my trauma has come from. So yeah, I love having a straight pelvic floor PT. It's great.
Sure. Um, Yeah, yeah. So we do perform trauma informed care here. It's really important. I think everyone kind of goes through trauma, not in like the 2026, everyone's fucked and has a past that they need to talk about. But truthfully, I mean, someone has an experience that rubbed them the wrong way and they kind of need to get through it. We never spoke about these experiences, but myself as a practitioner, Dr. Josh, Dr. Sam, we're behind the scenes. We're very much aware of kind of like what's going on with our patients, and we treat them based off. And when we say individually, like it truly is. You know, there's so many practices in New York that say, "Oh, everything's individualized to the patient," but the truth is, it's not that's not the case, right? So how we speak to you, how we engage with you every time you come in, the things we avoid to talk about, things we decide to bring up. How hard we're working on your lower abdominals, your perineum, the internal, um, how we're getting you to regulate your breathing. All these things are highly individualized to the patient in front of us. And so we want to make sure that we're providing a stimulus to the body where it can say, I'm safe. I can let go. I can not focus on my pelvic floor. Breathe through this procedure. And then at the end, you're like, oh, I feel lighter. I feel better. And you've just tapped into what your pelvic floor feels like when it lets go. And that's
Oh yeah.
huge. I think most men would be better off dealing with pelvic floor. I think at some point you're gonna have a yearly physical for pelvic floor. They're gonna be practice prophylactic care.
Yeah, I think that would be brilliant. I mean, even every time I have a session with you, every time I leave, I am so relaxed the rest of the day because my muscles are finally relaxing and it just affects me for the rest of the afternoon. Like I'll call like one of my friends and they're like, "Oh, did you just come from PT? You're really relaxed." And I'm like, "Yeah, it's great." Because and again, not in a sexual way. It's my body is physically releasing so much tension that's been there and just been holding on that I'm not thinking about. And I agree with you. I think more men would be better off going and seeing a pelvic floor PT and because I don't know, I also think of my dad too and his prostate cancer. I just think there's there's so many people that would benefit from this work. And I think it's really important.
Yeah. Yeah, I mean, just a fun fact. Have you heard of something called bruxism, which is clenching of the jaw?
I've heard of it. Yeah, yeah.
Okay. So if you go to a dentist, they're probably going to tell you, "Hey, you clench your jaw," and so does everyone, right? Last time I went to a dentist, I was like, "Show me your jaw, bro. Like, let me see your jaw," because I know everyone does it. But I went off on a tangent, but there is a huge correlation to people who are diagnosed with bruxism and pelvic floor hypertonicity,
Mm.
increased state of tone, right? And so we know that there is some sort of sympathetic dominance going on, and once you tone that down, both of those things kind of like go by the wayside. So it's really important to. I would encourage if there's any other pelvic floor therapists watching this, that is where you want to get your patients to be, right? Through the parasympathetic tone and are able to feel what it feels like to relax. It's really important. Um, Yeah. So I guess if there's one question I have, it's like, first of all, is there anything else that I missed that you kind of want to touch upon?
I guess you just answered it. I was thinking about this as you were saying it, but when I came in, you told me I have a hypertonic pelvic floor, and I don't think we had said that on the podcast yet. Which I didn't know what that meant, and obviously there's tension that I've been holding on to and you could probably explain it much more eloquently than I can, but I just wanted to say that because I think it's important for other people to know if they're feeling like they have similar symptoms.
Yeah, I mean, look, within the pelvic floor realm, therapists kind of tell everyone, especially men, oh, you have a hypertonic pelvic floor. With you, just based off of your symptoms on paper, one would know that you had a hypertonic pelvic floor without even doing an evaluation, honestly. You
Hmm.
had trauma there, you had surgeries, no shit, you'd have a hypertonic pelvic floor. But you remember, I didn't say it as if like, oh, you're screwed and you need to be here. You have a hypertonic pelvic floor. I said it so you can kind of understand what's going on. There's an increased stated tone. Your body learned this as a response over time, and it just stayed that way. And we're just teaching you to undo that. Um, we're not here to pathologize you. You've already went through enough. I think what I want to say for that is just we're just trying to explain what was going on.
Yeah,
Yeah. Take away the fear, not add more fear to fear. Yeah. And that's really
absolutely.
important. And so I'm glad you still feel good. I'm glad that we could help change your life. Honestly, I'm so grateful that we're able to. I'm so grateful that we have this practice here that's able to help men like yourself. Of course, do something as simple as going to the bathroom, but also having good sex again, because that's important for anyone. Um, and thank you for trusting us.
Absolutely. I mean, I again changed my life. I can't repeat this enough. When you're dealing with something physical that only you really know about, or there's shame around, especially with men, it feels so isolating. And after so long of being feeling isolated, struggling alone, and then finding a solution, it's just huge. It's like you feel like you can kind of take on the world. It's funny because I'm like, oh, I just if I distill it down, and I'm like, oh, I just needed a straight pelvic floor PT to, finger me, and things would magically work. But it's like it's so much more than that. But like when you find a solution after so long, it is really life changing and affirming because it's so easy, especially in this day and age, to just self shame and self sabotage and it's make myself feel crazy and like I didn't know that how my body worked, and it has really changed my life. It's been such an empowering experience, and um, I talk to everybody about it now. It's become the thing that I recommend all the time. New Year's Eve, I was at a brunch with a bunch of women, and they were like talking about pelvic floor PT, but like none of them had been. And then I started telling them my experience, and they're like, "Oh, now I want to go." And I'm like, "Pelvis NYC, like, oh, it's great. It's like it's the best. I feel like you'll have." Results, and there's things I just didn't expect to understand, and I think that are the results I wasn't expecting. Like I went in and I was like, oh, I want to see if there's any sort of solution here, but then again, like the psychological, there's so much more holistically that I got from this than just the, oh, I can have sex now and I can have more comfortable sex. It's so much more than that. It's like it's the release of shame, it's the release of like that narrative in my head, the limiting beliefs. So anyways, thank you.
Of course. So anyway, thank you for coming on. And obviously, Daniel's now a friend. I've always told him like if you're in the area, just stop by to say hello. Um, and thank you for trusting us again. And I hope we never have to see you again
Same, but I want
in that
to.
capacity, of course.
Yeah,
Awesome.
cool.
Well, great.